Hello, Campbell Tui here. Tonight my role in the ICU is I'm acting as a rapid response nurse. The ICU nurses who are trained take rotations of this role. My role tonight is to be an extra hand on the unit to help out with turns and with patient care and setting up lines and assisting the staff on the unit. Also, my role is I go around the hospital and I check on the units to try to identify any patient who might be of concern, who might require admission into ICU. The rapid response nurse carries a pager with them, and what happens is the pager might go off on the unit somewhere in the hospital where a patient is, or the staff are concerned about the patient's well-being, that either being the rapid heart rate, a low heart rate, high blood pressure, low blood pressure, just generally concerned about a patient in respiratory distress, etc. If my pager goes off, I go to that location on the unit and I take this cart with me. It's got a variety of medications, for rescue medications, cardiac monitor. Inside the drawers, we have some medications here, IV tubings, IV supplies for blood work that is required at the bedside, and some airway management supplies. Rapid cart carries oxygen and portable suction, and because N95s or the COVID situation, we have N95 masks, a variety of which are available within the cart for the nurse. So basically it's a little crash cart on wheels that I can take to the scene of a patient on the floor, try to stabilize them. If I can't stabilize them, and make arrangements to bring that patient into the ICU where we can monitor them more closely and treat them here in the ICU. Here's our ICU. Always look a little bit empty. That's because all the nurses are inside the room doing care. Plus we have an incident going up around the corner, which is occupying a lot of our nurses who are with a patient who's critically ill, who is decompensating and being intubated at the moment. So looks dark here, being night, but actually still quite busy here in the ICU, even though it's a night shift. Tonight I'm going to show you what a central lines cart looks like. The nurse is responsible for setting up the central line. Central line is used to provide venous access to a patient who is critically ill. It's basically 3 IVs in one and goes into a large vessel. And it's inserted through subclavian or the interjugular, or sometimes down in the femoral vein. The central line is a large vessel IV, more or less, that can deliver medications that are sometimes more irritating on the veins and deliver higher volumes of medications and fluids. This is all done under sterile technique, where we freeze the section of the insertion site, the interjugular or the subclavian, sutured in, sterile flushes. The physician will wear a gown. The patient is totally draped in a sterile gown. We have a sterile cut down tray or minor suture tray, the central line kit that goes in, and that's just basically the nurse's role to assist with the insertion. This here is one of 2 of our negative pressure rooms we have in the ICU. We have a monitor that we can change from normal to regular, rather, to neutral. That will make this room here a negative pressure room. We use this room when we have to intubate a patient who is COVID positive. It's also, there are other airborne illnesses such as tuberculosis. So this is the room we would use under negative pressure. When going in the room, we would be donning, we call it donning, our personal protective equipment, which is our N95 mask, gown, gloves, eye protection. We enter the room. In this room we would have the patient in here. We have our monitors, our monitor here, IV poles, everything that is required to have the patient in here at a time. We also have a little workstation here, sink, some supplies that are kept on hand. You can hear the noise, unfortunately, of the negative of the air evacuation system, moving the particulate from this room.